Hello, and thank you for choosing Medical City Fort Worth. We are honored that you chose Medical City Fort Worth for your joint replacement surgery. To ensure you have all of the required information, this video will cover everything you need to prepare for your upcoming surgery and stay with us. This will include how to prepare for surgery, nursing care, therapy services, joint precautions, and finally, discharge planning. Please make sure that you write down your questions during this video, and at the end, there will be a phone number provided where you can speak with someone from our outstanding staff who will be happy to answer all of your questions. Thank you for taking this time to watch, and we look forward to meeting you.
Prior to your surgery, you will receive a call from someone in our scheduling department to ensure you are scheduled for a pre-admission testing visit. It is crucial for this visit to be completed 7 to 10 days prior to your scheduled surgery. If for some reason you have not received a call within 2 weeks of your surgery date, call us at 817-347-5898 and a member of our staff will schedule your appointment. Walk-in appointments are also available Monday through Friday from 7:30 a.m. to 3:30 p.m. The following is a list of required items for your pre-admission testing visit. Please pause the video here so you can ensure you have all of your items. Any and all medications that you are currently taking. This should include over-the-counter medications and/or supplements, your photo identification, and your insurance card. During this appointment, a nurse will need to obtain your medical history. This will include medications, allergies to medications, and perform any additional needed tests prior to your surgery. If you have any records from a past test, please bring them with you to the appointment. Depending on the amount of testing required, the appointment could last up to 2 hours, so please plan accordingly. During this visit, the nurse will also swab your nose in order to test for MRSA or an antibiotic-resistant staph. If found, your surgery will not be delayed, but special antibiotics will be used the day of your surgery and medication will be given to use prior and while you are here in the hospital. During this appointment, you will be given the time of your surgery, what medications to take the morning of the procedure, and a special soap to use prior to surgery. It is mandatory and very important to use this soap because it is the first line of defense to avoid infection. The soap must be used both the night before and the morning of your surgery. Wash yourself from the neck down, avoiding your private areas, and pay special attention to the area where your surgery will be performed. If you cannot reach that area, please have someone assist you. The soap should stay on for 2 minutes prior to rinsing. Please avoid fragrant, lotions, and deodorant, as these things could interfere with the effectiveness of the soap. In preparation for your surgery, we recommend that you stop taking all blood-thinning medications and/or supplements 5 to 7 days prior to your scheduled surgery date. Make sure that you consult with your prescribing physician and surgeon before you stop taking this medication. The doctor and surgeon will consult with each other to make sure you safely wean off the medication before surgery. Keep in mind that over-the-counter medications such as aspirin and supplements such as fish oil can have a blood-thinning effect, and you will need to stop taking these medications 5 to 7 days before surgery as well. We also strongly encourage you to refrain from nicotine and nicotine products, as these will slow down the healing process. It is important for you to prepare your home and set up a support system prior to surgery. We recommend that someone stay with you for at least the first week after surgery. You will not be able to drive upon discharge from the hospital, so please have rides pre-planned. In addition, here are some steps you can take to prepare your home. Remove any potential trip hazards such as throw rugs and cords. In addition, have a plan for animals if they tend to run under your feet. Add night lights to the area you will be staying. Move all dishes, pots, or pans, or anything else you will need to waist level. Put clean linens on your bed and prepare meals. Set up your shower environment with a long-handled sponge or loofah, and have a place to sit in the shower. You will need a standard rolling walker after surgery. This is a standard upright walker with front wheels, not a rollator with a seat and wheels in the front and back. If you have a walker or are able to acquire one ahead of time, this will help you with your discharge planning. The night before your surgery, please make sure to use the soap provided and do not eat or drink after the time instructed during your pre-admission testing visit. This time may vary depending on your surgeon and medical history. In some cases, your surgeon will require you not to eat or drink after midnight, and in other cases, they may allow you to have clear liquids up to 2 hours prior to surgery. You may also have medication to take the night before surgery. Please follow the individualized requirements given to you in your pre-admission testing visit and by your surgeon.
When the morning of your surgery arrives, make sure to use your soap and take all of your medications as directed during your pre-admission visit. Everything you wear should be loose and comfortable, and please bring a change of comfortable clothes with you. All valuables should be left at home during this time. You're welcome to park in the front lot of the hospital, but we also provide a complimentary valet service which is available Monday through Friday from 7 a.m. to 7 p.m. Once you have arrived inside, you will need to check in at our information desk. They will assist in guiding you to our pre-op area, which is located on the second floor. Once you have arrived in pre-op, several accuracy checks will be performed. These are done prior to surgery for your safety. You will be asked about your surgery, any allergies, your name, and date of birth. These are asked several times. Your nurse will review your medical history with you to make sure that everything is accurate. During pre-op, you will change into a hospital gown, begin an IV for fluids, and apply compression sleeves to your legs or feet. Some oral or IV medications will be given at this time, and along with the nerve block done in surgery, will help manage your pain after surgery. If you have any allergies, it is at this time your nurse will place an allergy band around your wrist. At this time, you will meet your anesthesiologist along with the surgical nurse. Your surgeon will also come by to answer any additional questions that you might have and will mark the surgical site. If you are on clear liquids, your surgeon may prescribe a carbohydrate drink 2 hours prior to the procedure. We allow 1 or 2 guests, friends or family members, to wait with you as you prepare for surgery. But when you leave for surgery, the guests will need to wait in the waiting room located on the second floor adjacent to the pre-op area. A nurse will help them to the waiting room and make sure they get checked in at the desk. There's a cafeteria on the first floor which is open from 7 a.m. to 2 p.m. and there is also a Subway sandwich location in the cafeteria that remains open until 11 p.m. Once you have arrived in the operating room, your anesthesia will begin. In our operating room, sterile technique is used to aid in the prevention of infection. Typically, a urinary catheter is not required, but if placed, it will be removed in the operating room. If you have a medical reason to have a catheter until you get to the orthopedic floor, we will try to remove it as soon as possible. In most cases, it will be removed within 48 hours because after that time, a catheter can increase your risk of infection. The length of surgery is typically an hour to an hour and a half. The surgeon will speak with your family after the surgery is complete, and throughout the surgery, our OR staff will send text messages to keep your family updated. Once your surgery has been completed, you will move to recovery, where you will remain until you wake up from anesthesia, your pain is controlled, and your vital signs normalize. This could take 1 to 3 hours. We limit visitors in the recovery room due to privacy and space, so please let your family know that after they speak with the surgeon, there will most likely still be some time before they will see you on the unit.
Most people who have a joint replacement go to our medical surgical floor after being discharged from recovery. On this unit, all of our rooms are private, the nurses are RNs, and all of the staff have special training in caring for patients who have had joint replacement procedures. There are no set visiting hours, and if you would like to have a family member stay the night, they are welcome, as long as they are over the age of 16. We can provide a pull-out cot or recliner and linens to accommodate them for their stay. While you are on the unit, there will be several medical devices in your room. Let's review some of the possible equipment that you could see during your stay. When you arrive in your room, a nurse will provide you with an admission folder. In this packet, you will find information about our hospital and some information about your joint replacement. We want to make sure you have time to review this education before you are discharged to ensure any concerns you have are addressed. The nurse will also provide your discharge instructions, so you have time to review these prior to your actual discharge. At Medical City Fort Worth, A trained professional will check on you every hour to ensure you have the things you need. Don't worry, we want you to rest, so if you are sleeping, we will not wake you up unless it is necessary. During these rounds, please feel free to ask for anything that you may need. We want to address any concerns in a timely manner, so please don't wait until rounds if you need to request something. Simply press the red button on your call light to contact the nurse. The call light also controls the TV and the overhead lights. As you awake from surgery, you will notice an oxygen tube in your nose. This is called a nasal cannula, and it helps provide oxygen to you for the first 12 to 24 hours after surgery. It's normal for a patient to require oxygen after surgery due to the use of anesthesia. Respiratory therapy will be monitoring your oxygen saturation and will discontinue the oxygen once the anesthesia is out of your system. Respiratory therapy will provide an incentive spirometer, also called an IS, and set a goal for you. They will teach you how to use your IS and will ask you to continue to perform 10 deep breaths every hour that you are awake. It is very important that you follow these instructions as they counteract the effects of anesthesia and also prevent fluid from building up in your lungs. A tracking sheet can be located inside your admission packet that can be used to track your goal of 10 deep breaths per hour when you are awake. You will be given an IV line prior to surgery that will help deliver fluids and medications during your hospital stay. If your IV begins to beep for any reason, press the call light so your nurse can correct the problem. We will stop delivering fluids and medications prior to your discharge, so you can begin to take them by mouth. A sequential compression device, or SCD, will be used throughout your entire hospital stay. Placed either around your feet or lower legs, the SCDs will compress and release and are vital to help decrease the risk of blood clots. They must be worn at all times while you are in your hospital bed. We want to protect the integrity of your surgery and do everything we can to help prevent you from falling. In order to accomplish that, there are a few rules for you to follow during your stay. You must wear footwear with traction. We will provide you with non-skid socks. You must call a staff member to help you walk. A gait belt will be used to help keep you safe. You must call a staff member when you get out of bed. This must be done without exception, even if you feel like you can do them on your own. You are taking new medications and are connected to medical equipment that have trip hazards, so please don't risk attempting any of this on your own. When we come to help, you will notice the nurse or therapist using non-skid socks and a belt, called a gait belt. The socks help prevent slips, and the belt allows us to protect the integrity of your surgery should you start to fall. As discussed prior, it is important to prepare your home and keep it free of trip hazards as well. While you are here, we will provide a walker for you to use in the hospital. Therapy will bring it to your room and adjust it based on your height. If you do not have a walker, case management can help you get one ordered. If you are not currently using a walker, you will only need a walker for 1 to 6 weeks after surgery, depending on your progression, balance, and precautions. Therapy will help you transition off your walker after you discharge from the hospital. As discussed prior, you will need a standard walker with wheels in the front only.
An expected outcome from surgery is pain, and we grade your pain level on a scale. Our scale ranges from 0, which is no pain at all, to 10, which is the worst pain imaginable. Our staff will check your pain level several times throughout your stay, and it is important to let us know how you are doing. We want to keep your pain at a functional level so you have the ability to participate in therapy and other tasks needed for recovery. It is important to work with your nurse and therapist on a plan for pain medication because it is easier to maintain a 4 on the pain scale than it is to lower your pain from a 9. Let us know if the pain plan is not working for you. It's helpful if you can describe the type of pain you are having, as most pain medications target a specific type of pain. The description of the pain will assist the surgeon in adjusting or adding to your medication. Let's talk about the different types of pain you might experience. The first type is surgical pain. This is usually described as a deep and throbbing pain localized to the incision area. The second type is muscular pain. Muscular pain is commonly referred to as muscle tightness, spasm, or a Charlie horse. If you begin to notice tightness in the muscles around the surgical site, please let us know. The last type of pain is nerve pain. This type of pain is less common after surgery. This is pain that radiates and can be described as pins and needles or a sharp electric type sensation. The nurse will review side effects of medications when he or she gives them to you. But one typical side effect of pain medication is constipation. We have several options for treating constipation in the hospital should you need. If you continue to have problems when you get home, try some over-the-counter products and make sure you are getting enough fiber in your diet on a daily basis. If constipation continues after you have tried over-the-counter medications, please let your surgeon know. In addition to medication, there are several non-medicinal treatments you can utilize to aid in decreasing pain. Whether that is listening to music, reading a book, or watching a movie, we would like to encourage you to bring anything that you know works as a pain distraction with you. We also have puzzles, magazines, books, an imagery channel, ice, and pet therapy where dogs come to visit patients in their rooms available to you. If you would like any of these options or there is something we can do to make you more comfortable, please let us know.
Anytime surgery is performed, there are risks associated with that surgery. Though rare, we would like to review possible complications, how they present themselves, and what to do if you notice any of these symptoms. The first possible complication is infection. The signs and symptoms of an infection is a red and hot area at or around the incision. Also, changes in color or the amount of drainage, accompanied with a fever. After surgery, we anticipate the surgical area to be irritated and tender because you just had surgery. However, if you notice the area getting worse, a change in drainage, or a fever, please alert your surgeon. There are several things we can do to prevent infection, but it all starts with the soap you receive during your pre-admission testing visit. In addition to cleansing with the soap the night before and the morning of your surgery, our team will cleanse the surgical area prior to surgery. Antibiotics will be given through your IV before surgery and during recovery. The surgery will be performed using a sterile technique, and if used, urinary catheters will be removed as soon as possible. The most important part of infection prevention is hand hygiene. There will be hand gel placed outside each door that everyone should use prior to entering the room. Please ask any visitors or family members to use this gel when they enter the room. Prior to discharge, your nurse will review incision care and the importance of washing your hands prior to changing your dressings. Please follow your instructions for showering and bathing. We ask that you do not submerge your incision in water until cleared by the surgeon. In most cases, the surgeon will allow you to take a shower, but check your specific discharge instructions for timeframes and any other restrictions. The second possible complication is blood clots. Blood clots present themselves as a red, hot, swollen, and painful area. The most common location for this to occur is in the calf. If you notice a red and painful area in the calf, which increases in pain with pressure or bringing your foot toward you, please alert your surgeon. Blood clots will be confirmed through an ultrasound, and if positive, blood thinners will be started. There are several things that can be done for blood clot prevention. The first is the use of your sequential compression devices, or SCDs. Please have these on while you are in bed at the hospital. Performing ankle pumps where you move your ankles up and down is effective in blood clot prevention as it helps pump blood back up to your heart. Walking is the most effective way to prevent blood clots. You will see therapy while in the hospital, and they will help you start this process and work with you to develop a walking program to continue at home. In rare cases, it is possible to have a blood clot and not be aware. In this instance, you would not know you had a blood clot until it moves. Blood clots will typically move into your lungs, which is called a pulmonary embolism, and it can be life-threatening. If you notice chest pain or shortness of breath, please call 911 and go to the nearest emergency room. The next complication we will review is pneumonia. The signs and symptoms of pneumonia are shortness of breath with a cough and a fever. If you have these symptoms, please let your surgeon know. Pneumonia can be prevented by walking and doing breathing exercises. The incentive spirometer we discussed earlier will be used for breathing exercises. The last complication we will review is hardware failure or dislocation. Healing takes time, and until the muscle and bone heal around the implanted hardware, you will be given some precautions to follow. These usually last for about 6 weeks, but may vary from person to person. Things such as osteopenia, osteoporosis, and exposure to nicotine products all affect the speed at which the bone heals. Specific precautions for each surgery will be discussed in the next section of this video. Please follow these precautions until they are lifted by your surgeon. Falling is the other thing that could lead to hardware failure. As discussed earlier in this video, please prepare your home and have someone to stay with you the first week after surgery.
Research has shown the two biggest things that lead to a successful outcome after surgery is how fit you are going into surgery and how soon a patient can get moving after surgery. Our therapy group is here to assist you with moving and will get you up as soon as it is safe to do so. Typically, this will occur the day of the surgery. Your physical therapist will assist you in getting up and walking a short distance. We would like you to get up and walk at least 25 feet 3 times in the first 24 hours after surgery, with the assistance of the physical therapy and nursing staff. The day after your surgery, you will have both physical therapy and occupational therapy. Let's discuss what they do. Physical therapy will focus on your overall mobility. Occupational therapy will focus on activities used for daily living, like dressing and bathing safely within your joint precautions. Please bring a change of comfortable clothes and shoes so occupational therapy can practice these tasks with you. Both therapists will give you exercises for you to work on while you are in the hospital and at home until you start working with your home health or outpatient therapist. Let's review the precautions for each surgery. For a knee replacement surgery, you will need to avoid kneeling on the joint, jumping, running, and the motion of planting your foot and twisting for 6 weeks until the bone has grown into the knee prosthesis. Early range of motion is very important, especially extension or straightening the leg. We ask that as you heal, you do not put a pillow under your knee or rest with your bed in a bent knee position. The therapist will be measuring your range of motion with a device called a goniometer. Your goal while here in the hospital is to get the leg completely straight or 0 degrees of extension to 90 degrees of bending. Once in your home, the goal for bending will increase to the same as your opposite side or 110 to 130 degrees. For an anterior hip replacement, or one where the incision site is on the front of the hip, you will need to avoid taking long strides, bridging, and turning your toes out. For a posterior lateral hip replacement, or one where the incision is on the side of the hip, you will need to avoid turning the toes inward, your surgical leg crossing the midline of your body, and letting your surgical side flex past 90 degrees. This will mean you need to put your surgical leg out in front of you when you get up from sitting. And if lying on your side, you will need a pillow between your legs. In some cases, your surgeon may ask you to refrain from active hip abduction or bringing your leg away from your body using your own muscles. Therapy will review these precautions with you during your treatment and will help make recommendations on any additional equipment needed during your recovery.
During your stay at Medical City Fort Worth, a case manager or social worker will review your chart, talk to you about your home environment, and will also help arrange any needed post-acute services. In most cases, you will go home after the surgery with home health therapy or outpatient therapy. Home health therapy is where a nurse, physical therapist, and occupational therapist come to your home and work with you for 30 minutes to an hour, 1 to 3 times a week for each discipline. Outpatient therapy is where you go to a physical therapy clinic 2 to 3 times a week for an hour to an hour and a half. Both will give you exercises to work with on your own. In some cases, you will have a preferred company that you have worked with in the past. We would like to know your selection as soon as possible. If you know prior to your surgery, please ask for a discharge planning form when you come in for your pre-admission testing visit and make your selection there. This form will be faxed to our case management team so that they are aware of your choice prior to admission. You will need a walker when you discharge from the hospital. In most cases, our case management and social work team can help arrange that for you. But depending on your insurance, you may have to have someone pick up a walker for you, or it may be delivered to your home instead of the hospital. Rarely, you may need to purchase a walker on your own to prevent a delay with your recovery. One example is, if insurance has purchased a walker for you in the last 5 years, they will not approve another walker. In this case, we can provide you with a list of places where one can be purchased. Depending on your case and physical condition, sometimes additional care is needed. Your care team will assess your mobility and individual needs to help make recommendations and ensure a safe transition from our hospital.
Thank you for taking the time to watch this video. We strive to make this a seamless process for you. If you have any additional questions, we would love to hear from you. You can contact our orthopedic manager at 817-347-6084. Thank you again for joining us and learning what to expect during your surgery. And as always, thank you for choosing Medical City Fort Worth.